Hi, I'm Dr. Joe Goldberg, a clinical professor of psychiatry at the Icahn School of Medicine in Mount Sinai in New York. I'm also the immediate past president of the American Society of Clinical Psychopharmacology, and I'm on the editorial board for Psychiatric Times. Throughout medicine, the concept of deprescribing doesn't just mean stop something, it means evaluate its relevance and then consider whether it's appropriate to continue it or not. There's lots of reasons why a medicine ought to get deprescribed, but it's not because medicines are bad. That would be an oversimplification of a complicated problem and a wrong and potentially dangerous, if not deadly, approach. Let's get rid of all the medicines, but rather to say, is it the right tool for the right job? If I have, for instance, bipolar disorder, an antidepressant may not be as good an idea as a mood stabilizing drug or certain atypical antipsychotics. If I have cognitive problems, before you assume a stimulant's the way to go, make sure I don't have dementia or substance use disorder or head trauma. So we want to be very thorough in evaluating whether the treatment aligns with the condition, whether the treatment's appropriate to the condition, whether it's being dosed properly, whether it's being taken as prescribed, and whether an adequate amount of time has gone by. So lots of factors can interfere with that aspect of appropriateness. The terminology then is no different than anywhere else in medicine. If you're on blood pressure medicines, diabetes medicines, estrogen replacement, migraine treatments, cancer treatments, antibiotics, everything in medicine, if it isn't working, reevaluate. But the misconstrual hazard is if someone were to take the term deprescribing to mean medicines are bad, rather than they're misapplied, they're misappropriated. So we want to be very, very clear. And the American Society of Clinical Psychopharmacology has been writing a lot about this in just the last few months, about sort of reclaiming the term away from its misconstrual as like medicines are bad in a sort of an anti-psychiatry way, so much as to say this more nuanced approach of assess whether the fit is appropriate for a given patient's presentation, and if the medicines are not the right fit, move on to something different.